Bismillahirrahmanirrahim. The quote for the day is Have more than you show, speak less than you know by William Shakespeare. Today we are going to discuss the monkeypox disease and I am giving this presentation under the kind supervision of Professor Dr. Saira Afzal. Today we will discuss about the introduction of the monkeypox, its global burden, Pakistan statistics, epidemiological trial, prevention and control, recent updates and MCQs regarding the monkeypox at the end. By the end of this presentation, the participants will be able to describe the epidemiological features along with prevention and control measures suggested for monkeypox and recent outbreaks. Monkeypox was first discovered in 1958 when two outbreaks of a pox-like disease occurred in colonies of monkeys kept for research, hence the name monkeypox. The first human case of monkeypox was recorded in 1970 in the Democratic Republic of Congo during a period of intensified effort to eliminate smallpox. Since then, monkeypox has been reported in people in several other Central and Western African countries. Most infections are in Democratic Republic of Congo. Outbreaks. The first outbreak of human or monkeypox was first identified in humans in 1970 in the Democratic Republic of Congo in a 9-year-old boy in a region where smallpox had been eliminated in 1968. During 1996 to 1997, an outbreak was reported in the Democratic Republic of Congo with a lower case fatality ratio and a higher attack rate than usual. A concurrent outbreak of chickenpox and monkeypox was found. In 2003, the first monkeypox outbreak outside of Africa was in the United States of America and was linked to contact with the infected pet prior dogs. Over 70 cases of monkeypox was reported then. Since 2017, Nigeria has experienced a large outbreak with over 500 suspected cases and over 200 confirmed cases and a case fatality ratio of approximately 3%. Cases continue to be reported until today. Monkeypox also has been reported in travels from Nigeria to Israel in September 2018, in UK in September 2018, December 2019, and May 2021 and May 2022. In Singapore, the outbreak occurs in May 2019 and in the United States in July and November 2021. And in May 2022, there are multiple cases of monkeypox were identified in several low and non-endemic countries. And in recent years, the worldwide outbreak of monkeypox in May 2022. This outbreak of monkeypox appeared suddenly and rapidly spread across Europe, the Americas, and then all the six WHO regions, with 110 countries reporting about 87,000 cases and 112 deaths. The global outbreak has affected primarily but not only the gay, bisexuals, and other men who have sex with men and has spread person to person through sexual networks. In 2022, outbreaks of monkeypox due to clade 1 monkeypox virus occurred in refugee camps in the Republic of the Sudan. A zoonotic region has not been found. These are the countries, and the date is 21 May 2022, where the greatest number of cases of monkeypox was reported during the outbreak. And this is the area map showing the greatest numbers of monkeypox in May 2020 was reported from the Spain, the UK, and the other American and Australian countries. Now, the epidemiological triad of the monkeypox. The agent for the monkeypox is an inevitable stranded DNA virus. Monkeypox virus belongs to orthopox virus genus in the family Poxviridae. The orthopox virus genus also includes variola virus, which causes smallpox, vaccinia virus used in smallpox virus, and copox virus. Natural host of monkeypox virus. Various animal species have been identified as susceptible to monkeypox virus. This includes rope squirrels, tree squirrels, Gamian pouch rats, dormice, non-human primates, and other species. Uncertainty remains on the natural history of monkeypox virus, and further studies are needed to identify the exact reservoir and how virus circulation is maintained in nature. The reservoir host, the main disease carrier monkeypox, is still unknown, although African rodents are suspected to play a part in transmission. The virus that causes monkeypox has also been recovered twice from an animal in nature. In the first instance, in 1985, the virus was recovered from an apparently ill African rodent, that is rope squirrel, in equator region of the Democratic Republic of Congo. In the second term, that is in 2012, the virus was recovered from a dead infant mm, Mengabe found in the Thai National Park, that is located in Port Ivory. The incubation period for monkeypox is usually 7 to 14 days, but it can vary from 5 to 21 days. Monkeypox is usually a self-limited disease with the symptoms lasting for 2 to 4 weeks. For individuals exposed to virus, temperature and symptoms should be monitored twice per day for 21 days because it is accepted upper limit of monkeypox incubation period. Infectiousness aligns with symptoms onset. Therefore, close contacts need to be not isolate while asymptomatic. So coming towards the pathogenesis of monkeypox, the infection can be divided into two periods, that is the invasion period and the other period. The invasion period lasts between 0 to 5 days and it is characterized by fever, intense headache, lymphadenopathy, back pain, myalgia, and intense asthenia, that is the lack of energy. And the other period is characterized by the lymphadenopathy, that is a distinctive feature of monkeypox compared to other diseases that may initially appear similar, that is chickenpox or the smallpox. Within 1 to 3 days, sometimes longer after the appearance of fever, the patient develops a rash, often belonging to the face, on the face spread to the other parts of the body. Linear progress through the following stages before falling off, that is macules, papules, vesicles, pustules, and scabs. The illness typically lasts for 2 to 4 weeks. In Africa, monkeypox has been shown to cause a death in as many as 1 in 10 persons who contract the disease. The skin eruption phase. It usually begins within 1 to 3 days of the appearance of fever. The rash tends to be more concentrated on the face and extremities rather than on the trunk. It affects the face in 95% of the cases and the palms of the hands and soles of the feet in 75% of the cases. It also affects oral mucosa membranes, genitalia, conjunctiva, as well as cornea. The rash evolves sequentially from macules to papules to vesicles to pustules, and at the end, the crust has been found. The number of lesions vary from a few to several thousand. In severe cases, lesion can coalesce to form large skin lesions that eventually slough off. The symptomatology of the monkeypox are similar to but milder than the symptoms of smallpox. Monkeypox begins with fever, headache, muscle aches, and exhaustion. The main difference between symptoms of smallpox and monkeypox is that monkeypox causes lymph nodes to swell, while smallpox does not. This is the distinctive feature of the monkeypox virus, that it causes lymphadenopathy. The illness begins with fever, headache, muscle aches, back aches, swollen lymph nodes, chills, and exhaustion. The complications that can result are bronchopneumonia, sepsis, and encephalitis, and the infection of the cornea with any ensuing loss of vision. The extent to which the asymptomatic infection may occur is unknown. The case fatality ratio. Case fatality ratio is the number of deaths that has been occurred within the known cases of the disease. So the case fatality ratio of monkeypox was from 0 to 11% in the general population and has been higher among young children. In recent time, the case fatality ratio has been around 3 to 6%. Now, coming towards the laboratory testing for the monkeypox virus, the confirmation of monkeypox virus isolation is based on nucleic acid amplification test that we called it as NAT. Using real-time or conventional polymerase chain reaction (PCR) for detection of unique sequence of viral DNA, PCR can be used alone or in combination with sequencing. The recommended specimen type for laboratory confirmation of monkeypox is skin layer material, including swabs or lesion surface and or residue. Proofs from more than one lesion or lesion crust. LS results, positive or negative, should be immediately be reported to the national authorities. This is the algorithm for the laboratory guidelines of the monkeypox virus that was issued by the National Institute of Health Pakistan in May 2022. If you have any suspected monkeypox case, take lesions from the swabs, ARCAS, or vesical fluids. Then, if the monkeypox virus has been detected on real-time PCR or the sequencing, it may be positive or negative. If it comes out to be negative, roll out the monkeypox virus, and if it comes out to be positive, then we will go for the clade in identification through real-time PCR. Transmission. There are two modes of transmission for monkeypox virus, that is animal to human transmission, and the other is human to human transmission. Zoonotic transmission can occur from direct contact with the blood, body fluids, or cutaneous or mucosal lesions of the infected animals. While human to human transmission can result from close contact with respiratory secretion, skin lesions of an infected person, or recently contaminated objects. Transmission via droplet respiratory particles usually require prolonged face to face contact. Treatment. Currently, there is no proven safe treatment for monkeypox virus. For purposes of controlling a monkeypox outbreak in United States, smallpox vaccine, antivirus, and vaccine immunoglobulins has been used. Smallpox vaccine, Pseudofiber ST246, and vaccinia immunoglobulin can be used to control a monkeypox outbreak. So these are the antiviral drugs that are Pseudofiber and brain pseudofever. That is not available on the vaccine of pseudofever and brain pseudofever in treating human cases of smallpox. However, both have been proven activity against poxvirus in vitro and animal studies. Brain pseudofever may have an improved safety profile over pseudofiber. Serious genotoxicity or other adverse effects have not been observed during treatment of cytomegalovirus infections and brain pseudofever as compared to treatment using pseudofiber. Not ticovirome Ticovirimat, that is also called ST246, that is not available on the factors of ST247 treating human case of monkeypox. Studies using a variety of animal species have shown that ST246 is effective in treating orthopox virus. Human clinical trials indicated that the drug was safe and tolerable with only minor side effects, although currently stockpiled by the Strategic National Stockpile. Use of ST248 administered under the IND. Vaccine immune globulin. That is not available on the effectiveness of vaccine immunoglobulin in the treatment of pox complications. Use of vaccine immunoglobulin is administered under an IND and has not proven benefit in the treatment of smallpox. Prevention. There are a number of measures that can be taken to prevent infection with monkeypox that are avoid contact with animals that could harbor the virus, that is including animals that are sick or that have been found dead in areas where monkeypox occurs, and avoid contact with materials such as bedding that has been in contact with the sick animal. Isolate infected patient from others who could be at risk of infection. Practice good hygiene after contact with infected animals or humans, for example, washing your hands with soap and water or using an alcohol-based hand sanitizer. Use personal protective equipment when caring for the patients. There are some other additional precautions that you need to prevent and that you need to take. That are proper hand hygiene after all contact with an infected patient, correct containment and disposal of contaminated waste, care when handling soil laundry, care when handling used patient care equipment, ensure procedures are in place for cleaning and disinfecting environmental surfaces. Now, coming towards the vaccine of the for the monkeypox, there are three vaccines against monkeypox virus. The and these vaccines have been given on the sites of the WHO. Many years of research have led to the development of newer and safer vaccines for an eradicated disease called smallpox. These are MVAPN, LC16, and Orthopoxvac that have been approved for prevention of monkeypox virus. Only people who are at risk, for example, someone who has been a close contact of someone who has monkeypox virus, or someone who belongs to a group at higher risk for exposure to monkeypox, these only individuals should be considered for vaccination. Mass vaccination is not currently recommended for monkeypox. Mark this word that mass vaccination is not currently recommended. On the surveillance system for monkeypox. The key objectives of surveillance and case investigation for monkeypox are to rapidly identify cases, Cluster another source of infection as soon as possible in order to provide optimal clinical care and isolate cases to prevent further transmission, identify and manage contacts, and tailor effective control and prevention methods based on most identified routes of transmission. No, these are the case definitions for the monkeypox virus data is given on May 2022 during the outbreak of monkeypox virus by the National Institute of Health, Pakistan. So they declared suspected case as a person or of any age presenting with an unexplained acute rash. Along with it, there may be one or more of the following signs or symptoms since uh, 15 March 2022, as these guidelines were issued on 21st May 2022. These signs are headache, acute onset of fever, lymphadenopathy, back pain, myalgia, or asthenia. And for which the following common causes of acute rash do not explain the clinical picture that are varicella zoster virus, herpes zoster virus, measles, herpes simplex, dengue fever, bacterial skin infections, and other relevant common causes of papular vesicular rash. They also given the note that it is not necessary to obtain negative laboratory results for listed common causes of rash and in illness in order to classify the case as suspected. They propose that the probable case will be a person meeting with the case definition for a suspected case and one or more of the following that has an epidemiological link to a probable or a confirmed case of a monkeypox in the 21 days before symptoms onset and reported travel history to a monkeypox endemic country in the 21 days before symptom onset and is hospitalized due to the illness. And it said that the confirmed case will be a case meeting the definition of either a suspected or probable case and a laboratory confirmed from monkeypox virus by a detection of a unique sequence of viral DNA either by real-time PCR or sequencing. So the confirmed case should be laboratory confirmed case. So the reporting that these guidelines are also from by the National Institute of Health. Because of the public health risk associated with a single case of monkeypox, clinicians should report suspected cases immediately to provincial and federal health authorities, regardless of whether they are also exploring other potential diagnoses. Cases should be reported immediately according to the case definitions. All the confirmed cases should be notified immediately to the National Institute of Health and provincial health departments. Laboratories that perform sequencing are encouraged to submit monkeypox virus genome to GISAIDR and CBI. This is the monkeypox testing requesting form that is given by the National Institute of Health. The details that have to be mentioned apart from the apart from the personal details are the symptoms associated that are associated with the monkeypox virus and the travel history of the patient and the other examination findings that are rash, lymphadenopathy, or other findings. Sorry. Now coming towards the control of the monkeypox, the precautions that are needed to prevent monkeypox transmission are a combination of standard contact and double precautions that should be applied in all healthcare settings when a patient presents with fever and vesicular rash. That is isolation. Negative air pressure room, placing a surgical mask over the patient's nose and mouth and covering any of the patient's exposed skin lesions with a sheet or gown. So we have to keep the patient in an isolated room with the personal protective equipments. Use of disposable gown and gloves for patient contact. Use of NIOS certified N95 and comparable filtering disposable respirator that has been fit tested for the healthcare worker. Isolation of the patient at home. Person with extensive lesion that cannot be easily covered. Draining, weeping, lesions are respiratory symptoms that are cough, sore throat, runny nose should be isolated in a room or a area separate from other family areas when possible. Persons with monkeypox should not leave the home except as required for follow-up medical care. They also should avoid contact with wild or domestic mammals if possible. Unexposed persons who do not have an essential need to be in the home should not visit. Household members who are not ill should limit contact with persons with monkeypox. Pets should be excluded from all the ill persons environment. No prevention of the monkeypox through restrictions on animal trade. Some countries have put in place regulation on restricting importation of rodents and non-human primates. Captive animals that are potentially infected with monkeypox should be isolated from other animals and placed into immediate quarantine. Any animals that might have come into contact with an infected animal should be quarantined, handled with standard precautions, and then observed for monkeypox symptoms for 30 days. Now, what measures do the travelers adopt? Avoid animals when traveling. Do not touch live wild animals. Do not touch or eat products that come from wild animals. Avoid markets or farms with animals. Avoid touching with materials such as bedding that are used by animals. If you are traveling to work with animals, wear appropriate protective gears and wash your hands. Wash hands often with soap and water. If soap and water does not available, use alcohol-based sanitizer. Keep your hands away from your eyes, nose, and mouth. If you need to touch your face, make sure your hands are clean. And avoid close contact with people who are risk. Do not kiss, hug, or share eating utensils or cups. Do not touch the bedding or clothing of a sick person. Now coming towards the statistics of Pakistan regarding the monkeypox. This is an article that was published in 2024 who started its first case of monkeypox in Pakistan. WHO's response and steps to prevent an outbreak. In on 21 April 2023, on 21st April 2023, about a year ago, health officials confirmed the first monkeypox case in Islamabad, Pakistan. The patient was 25 years old Pakistani man who had recently returned from Saudi Arabia and exhibited disease symptoms. As the patient was quite unwell, he was sent to quarantine in a hospital and tests were conducted to determine the cause of his symptoms. The health officials did not give any more details about the man. Patient's relatives were not sick nor had any symptoms, but still they were asked to stay at home and avoid contact with others just to be safe and stop the virus from spreading. So the first case of monkeypox in Pakistan was reported on 21st April 2023. So the response of WHO is that the current epidemic of monkeypox in Pakistan has pushed the WHO and Pakistani government to work together actively. Efforts are being made to prevent the virus's spread and to offer the best clinical treatment possible to those who have been infected. The WHO has agreed to support the Pakistani government in a variety of ways, including lab testing, points of entry, distribution of testing kits. In addition to authorities were instructed to put in place measures such as laboratory diagnostics, contact tracing, and early identification of suspected cases and infection clusters, and guarantee effective surveillance. Possible monkeypox cases should be evaluated in properly accurate laboratories utilizing nucleic acid amplification testing and real-time PCR. There is another article that was also published in 2024 who started first human death due to monkeypox virus in Pakistan public health concern for resource limited non-endemic countries. So since January 24, there are 7 cases of monkeypox reported in Pakistan. And the first human death, Pakistan reported its first death from monkeypox. The, dec- the deceased is a 40-year-old man who had recently returned from Saudi Arabia and had been under medical care for several months, passed away on Sunday morning. Coming towards the recent updates, the first article is monkeypox unlikely to be a COVID-19 like pandemic. Several public and private health facilities, including the Aga Khan University Hospital, also issued their emergency infection alerts regarding the monkeypox and advised the staff to remain cautious, follow the infection prevention and control guidelines, and take proper infection control measures. Although experts believe that monkeypox is less likely to become a pandemic like COVID-19 despite the being a zoonotic disease which spread from animals to humans, the National Institute of Health Islamabad issued an alert that tracking all federal and provincial health authorities to remain on high alert for any suspected case of the monkeypox. The other article, the changing epidemic of human monkeypox, a potential threat, a systematic review. Our review shows an escalation of monkeypox cases, especially in the highly endemic Democratic Republic of Congo, are spread to other countries and growing median age from young children to young adults. These findings may be related to the cessation of smallpox vaccine, which provided some cross protection against monkeypox, leading to the increased human-to-human transmission. The appearance of outbreaks beyond Africa highlights the global relevance of the disease. Increased surveillance and detection of monkeypox cases are essential tools for understanding the continuously changing epidemiology of the resourcing disease. Now coming towards the MCQ session. The first MCQ is that a 35-year-old man presents with fever, headache, and a rash on his face and body. He recently traveled to a country where monkeypox is endemic. What is the most likely mode of transmission of monkeypox in this case? Whether vector-borne transmission through an infected mosquito bite, zoonotic transmission through contact with infected animals' body fluids, human-to-human transmission through respiratory droplets, fomites transmission through contact with contaminated bedding and clothing, transmitted via sharing food and water. Which is the most appropriate option
B.
for the transmission? It's C, human-to-human transmission through respiratory droplets. Second MCQ is a healthcare worker is caring for a patient suspected for having monkeypox. What is the most effective way for a healthcare worker to prevent transmission of the virus? Whether wearing a surgical mask and gloves, wearing a full personal protective equipment suit, including a respiratory gloves and gown, practicing good hygiene and using standard precautions, administering a vaccine to the patient, or using ultraviolet light disinfection in the patient's room.
C.
Yes, it's B, wearing a personal protective equipment. Third MCQ is a traveler is visiting a country where monkeypox is endemic. What can they do to reduce the risk of getting infected? Whether getting a vaccine against smallpox, as it provides some protection against smallpox, against monkeypox, avoid contact with infected animals and washing hands frequently, taking antiviral medication as preventive measure, wearing a mask in public places, drinking bottled water to avoid contaminated water sources.
A.
No, mass vaccination for monkeypox is not recommended. So the correct option will be avoiding contact with infected animals and washing hands frequently. Fourth and MCQ is our community is facing an outbreak of monkeypox. What is the most effective way to prevent further transmission of the virus? Whether implementing isolation and quarantine measures for infected individuals, conducting contact tracing and monitoring close contacts, distributing the vaccine to the entire community, improving ventilation in public places, enhancing cleaning and disinfection protocols in public areas.
A.
Yes, it's a isolation and quarantine measure for infected individuals. Fifth MCQ is in May 2021. A family returned to the United Kingdom after traveling to the Nigeria, and three family members became infected with monkeypox. The sequential timing of the symptom development in each case within the family on day 0, 19, and 33, which of the following would be the best control measure to limit the human-to-human transmission? Whether giving antiviral treatment, giving immunoglobulins, immediately isolate the patients, immediately reconfirm the monkeypox virus by PCR, give antibiotics to improve the symptoms first.
B.
It's C. We have to isolate the patient. Sixth MCQ is monkeypox, a viral infection that resembles smallpox. Infections that occurred earlier were probably diagnosed as smallpox because of similar clinical findings. Initial symptoms include fever, headache, myalgia, fatigue, and a key differential feature of monkeypox from smallpox, whether renal dysfunction,
B.
lymphodeficiency, bone marrow suppression, degree in lefties, and LDH level, or severe GIT symptoms. Which one is the correct option?
B.
It's B, lymphadenopathy. The feature that distinguishing monkeypox from the smallpox is the lymphadenopathy. So the correct option will be beta B. Seventh MCQ is surveillance is to rapidly identify cases as soon as possible to control the spread of monkeypox in endemic countries and should be reported immediately to WHO and International Health Relations National Focal Points under the International Health Regulations 2005. Which of the following is as important as case detection during the surveillance? Whether contact tracing, treatment of cases, provision of free medication, relief camp for unprivileged population, or the vaccine campaign?
A.
Yes, contact tracing. From 2011 through August 2014, health officials in North Kivu investigated four individuals. Diagnostic specimens were submitted to the National Laboratory for with the first laboratory testing by PCR and the other is sequencing in negative for the monkeypox virus. Such a case is considered a probable, suspected, confirmed, discarded, or the index case. It will be
B.
it can be a suspected case B. Uh, as it has not been laboratory
B.
confirmed case, so it should be the a suspected case. A 73-year-old woman with cirrhosis reported with a fever, cough, fatigue, and rash on May 6, 2022. CT of the chest indicated infection in her bilateral lungs and bronchopneumonia. Lymphadenopathy was positive. The patient was admitted in hospital for decreased oxygen saturation. The probable diagnosis COVID-19, complicated monkeypox, measles, mumps, or the smallpox.
B. B.
Yes, it's complicated monkeypox as they has the features of cough, fatigue, and rash, and they has also developed the complication that is bronchopneumonia, and the patient additionally has the feature of lymphadenopathy, which distinguishes it from the smallpox. So it is a complicated monkeypox scenario. Last MCQ for individuals exposed to the virus, temperature and symptoms should be monitored twice per day for how many days? That is a safety upper limit of the monkeypox incubation period. Whether 14 days, 21, 7 days, 3 days, or the 10 days.
A.
It's B 21 days. That is the
A.
upper limit of the incubation period for monkeypox virus. It's 21 days. B. This is the key of the MCQs. This is our YouTube channel where all the recorded presentations by the postgraduate residents are uploaded here. And thank you very much for today.
Thank you very much, Dr. Wes. You have completed well in time. So, very nice presentation, very informative one. And I hope everyone has really learned a lot from your presentation. Thank you very much and see you in the department today. Allah Hafiz.
Allah Hafiz. Thank you, ma'am.